Endometriosis is one of the most common gynecological conditions, affecting up to 10% of women worldwide. If left untreated, this condition can severely disrupt their lives. Endometriosis has no cure, but it's encouraging that more and more studies are proving the positive effects of PEMF therapy on endometriosis. According to the studies, PEMF therapy can help reduce inflammation, promote healing, relieve pain, and increase oxygenation as well as circulation. Even though pain is common during menstrual cycles, women who have endometriosis experience much more intense pain than usual. For women affected by endometriosis, this sort of pain can usually be debilitating and prevent them from going about their day-to-day life. One of the most effective ways to deal with pain-related endometriosis is to receive PEMF therapy. It has been proven that the pain experienced by patients with endometriosis is caused by swelling and inflammation, which appears because of the abnormal endometrial cells. Fortunately, the most well-known health benefit of PEMF therapy is that it can effectively reduce inflammation and swelling throughout the body. PEMF therapy works to reduce swelling, inflammation, and pain by improving oxygenated blood flow. The ectopic lesions can also lead to the imbalance of estrogen, causing further inflammation. PEMF therapy can lower estrogen levels and balance hormones, which is helpful in the treatment of endometriosis. Additionally, many women with endometriosis often have chronic fatigue. PEMF therapy can raise ATP levels and help cells increase their energy by up to 500%. PEMF therapy can also open up membrane channels to make nutrients enter the cells and eliminate waste from cells easily and quickly. In this way, PEMF therapy can benefit women with endometriosis, helping them relieve chronic fatigue and improve the quality of life.